I'm Carmilla Henderson, and I'm a heart failure specialist nurse working for Torbay Hospital. And I have been here in the UK for 6 years now. I arrived in 2017, and I'm one of the first cohorts of international nurses who were employed by Torbay Hospital from the Philippines. I have been educated and got my degree in 2011 in St. Paul University, Iloilo in the Philippines, and since then I've been working as a nurse. My background is ITU in the Philippines for 5 years, and when I moved here in the UK, I worked in cardiology and now moved to heart failure as a specialist nurse. In 2015, as far as I can remember, a group of Torbay nurses and the recruitment team went to the Philippines to conduct a face-to-face interview, and that's how I've known what Torbay is and where Torbay is. And they were associated with a third-party agency back in the Philippines, and they conducted series of interviews and exams, and that's how I knew how to apply for Torbay. And support-wise, they have given us financial support to sit on our exams, be able to pass it, and be able to come here to the UK. So in 2017, when we arrived here in March, we were welcomed literally straight in the airport with a banner that says, "Welcome to the UK under Torbay Hospital." So we had Tracy, who is also working for the recruitment, Devon Alliance recruitment, as of the moment, picked us up in the airport, drove us straight to Torbay, and then after that we were introduced to our ward managers, and we had a welcome meeting the day after, and obviously they gave us food allowance, and they showed us what Torbay is like, so we really felt welcome during that time, because obviously it's a new environment, it's a new place. It's just four of us girls in a new country, in a new city, and then we don't know what are we expecting. So that welcome meeting with our managers really helped us. They introduced Torbay to us and presented us the different policies and procedures in Torbay. Since I moved here, honestly, I felt really welcome in the organization. I was fortunate enough that I was allocated into a very nice ward, very welcoming ward. My manager was very supportive in education-wise and in my professional growth. Both my manager and matron, actually, they helped me, gave me study days, and supported me until I get my registration here in the UK. Tips for other organizations to improve or like make their international nurses belong in their organization. I think you need to have like a gathering, or like what we did previously with Black Lives Matter. They organized a little community show, and I think that would help the international nurses feel that they belong, that they are being recognized in this institution, and also aside from that, educate people here that, especially with the different cultural differences that we have here, people need to be aware how to deal with other members of staff in the hospital. For my goals here in the UK, I want to stay and develop my career here in the UK, especially in Torbay. Now that I moved to a new role, and I'm a part of a new service that we're setting up for the heart failure team, I think it's a good way to say that we are adhering to the vision of the hospital, which is to provide better healthcare for its people. I've been here for about 6 years, and we've seen an increasing growth of our patients who need more care. So that's why I'm really grateful to be a part of this new service in order to provide patients with their autonomy to be looked after at home, and also to lessen the hospital admissions and to provide quality care for our patients in Torbay. Torbay Hospital will always have opportunities for us nurses and medical staff, but it needs to be both ways. We shouldn't expect that it will be handed over to us in a silver platter. As professionals, we need to find and grab those opportunities in order to develop and progress in our individual careers.